Welcome to Dr. Dean's bonus video titled Bureaucratic Diversion Destroys Affordable Healthcare. Everyone in the U.S. knows that healthcare is unaffordable both for individuals and for the nation. What most people don't know is why. Why is healthcare so incredibly expensive here? I have two words for you: bureaucratic diversion. First, let's see what we mean. Bureaucracy is that part of a company, an organization, or a system like healthcare that helps all the other parts do their jobs. Bureaucracy has no function of its own. It is there to assist everyone else. Bureaucratic diversion is an idea that came to me while researching the book Curing the Cancer in U.S. Healthcare. It happens when bureaucracy diverts money away from the rest of the system and spends that money on itself. In healthcare, bureaucratic diversion takes money needed for patient care and uses that money to pay for rules, regulations, mandates, advisories, guidelines, compliance, oversights, and more bureaucrats than you can possibly imagine. Check out this graph extending from 1970 for 40 years to 2010. Over that time, the supply of U.S. physicians increased 100%. It doubled. Over the same time period, the number of healthcare administrators and bureaucrats increased by more than 3,000%. For every one doctor we added, we hired 30 healthcare bureaucrats, and money to pay their salaries is money taken away from patient care. Two different bureaucracies divert healthcare dollars away from care: insurance and the government. Let's look at them one at a time. In 2018, the average American family spent $28,166 on healthcare. If you were healthy like most people, 83% of that, or $23,462 of your hard-earned dollars, were transferred into insurance company pockets, and you got, well, you know what you got. Bureaucratic diversion at work. Insurance isn't the only bureaucracy stealing your healthcare dollars, or even the biggest. That award goes to, drumroll please, the federal government. In 2018, the U.S. GDP was $21.4 trillion, a quarter of all GDP on Earth. We spent $3.6 trillion on healthcare, which was 17% of our GDP, while most nations spent less than 10%. Of that $3.6 trillion we paid into the healthcare system, $2.6 trillion went to care, and $1.4 trillion, or almost half, went to the federal bureaucracy. As Washington spends our healthcare dollars first on itself, healthcare providers and hospitals get the leftovers. In other words, Americans were denied more than $1 trillion worth of patient care by our own government. So, when you can't find a doctor or you wait forever to get in, you know now why. Washington is taking dollars needed to pay for your care, and it's paying itself. Bureaucratic diversion, indeed. For more on this subject, and to get affordable, accessible health care, please read Curing the Cancer in U.S. Healthcare, States Care, and Market-Based Medicine. If you have not already subscribed to the website We Can Fix Healthcare, please check it out at www.deanwaldman.com. That's Dean with an E. My mother did that to me 76 years ago. Just click on the blinking icon on the top right. There is no charge for all this material. In fact, encourage your friends and neighbors to subscribe. Also, be sure to subscribe to my YouTube channel to view the latest videos. Just click on my image to your right, and thank you for watching and for being part of the cure for our sick healthcare system.